Hi! Welcome to Mama's Connected. Before we start our discussion, if you enjoy this video, please don't forget to subscribe to our channel, Mama's Connected, for additional videos addressing all of your preconception, pregnancy, and new motherhood questions. When couples seek an evaluation with a fertility specialist, there can be a seemingly endless list of tests which they are required to complete. For most couples, it can be hard to decipher the significance of each of these tests. Today we will be exploring two of these tests that your doctor may use during the workup process, AMH and AFC. AMH stands for anti-Mullerian hormone. This is measured via a laboratory blood test. AMH is a hormone which is produced by the ovarian follicles. Your doctor will use this test to estimate the number of eggs that you may have in your ovarian reserve. A higher AMH level predicts a higher ovarian reserve and more eggs. Conversely, a lower AMH predicts a lower egg count and a lower ovarian reserve. So what is a normal AMH level? Understandably, many patients want to know whether their AMH levels are normal. The general ranges of normal are as follows. The severely low range is approximately 0.4 nanograms per milliliter. The low range is under 1 nanogram per milliliter. And the average range is between 1 and 3 nanogram per milliliter. It is important to note that AMH levels are influenced by age. In general, AMH levels tend to rise during adolescence and peak at around 25 years of age. Thus, it is expected that AMH levels will decrease over time. The estimated AMH level by age is as follows. At 25 years, 3. At 30 years, 2.5. At 35 years, 1.5. At 40 years, 1. And at 45 years of age, 0.5. While most fertility patients hope for a higher AMH level, higher AMH levels are not always desired. Specifically, an elevated AMH level may indicate another issue, such as polycystic ovarian syndrome. So, the next question, what is AFC? In fertility terms, AFC stands for antral follicle count. The AFC is measured via a transvaginal ultrasound. Your doctor will visually examine the ovaries during the ultrasound and count the number of follicles seen. Determining the AFC helps your doctor to predict the number of mature follicles that you have, as well as your likely response to IVF stimulation. So what is a normal AFC? Well, like the AMH, the average AFC decreases with age. The average AFC by age has been determined as follows. From 25 to 34 years of age, an average of 15 follicles. From 35 to 40 years of age, an average of 9 follicles. And from 41 to 46 years of age, an average of 4 follicles. You may be asking yourself, what is more important, AFC or AMH? Well, the answer is not totally clear-cut. Both AMH and AFC are predictors that your doctor can use to determine fertility. However, these tests only predict and do not determine future fertility with certainty for the most part. Additionally, fertility specialists have found that AFC and AMH levels often tend to be concordant. In other words, patients with a higher AFC level than expected often also have higher AMH levels. In situations where the AFC and AMH are discordant, for example, a high AFC and a low AMH, your doctor may decide to investigate further. Of note, AMH is a specific laboratory-derived value, while AFC can be influenced by the skill of the ultrasound technician. It is not uncommon for patients to see differences in their AFC when evaluated by one provider versus another. If there are concerns with the accuracy of the AFC, patients may choose to request that the evaluation be repeated. Thanks for joining me as we took a close look at AMH and AFC, two important tests done to evaluate fertility. If you are interested in watching similar videos, please check out our website, mamasconnected.com, which provides up-to-date articles on all of your preconception, pregnancy, and new motherhood questions. You can find the link to our website, Mamas Connected, in the description below. Until next time, my friend.